from Brindabella Podiatry. We just wanted to do a little live today on something that we see like a few times a week.
Very common, particularly in the beginning of the year when everyone goes back to school.
That's true, because they've gone from just being on holidays to then running around, sports start again.
Yes.
The condition we wanted to talk to you about today is called Sever's disease. It sounds bad, like it's some kind of leprosy or something. It's actually just a problem with the growth plate in children, and it's generally, the age bracket does vary. It's the couple of years when early puberty is starting. So generally for girls it's around 8 to 13, and for boys it's 10 to 15. So it does vary, but I guess on average the common age we see it is about 9 or 10. So what is Sever's disease? It's actually a problem with the growth plate in the heel, which is the calcaneus, the heel bone. And usually it's in children who are pretty active. So you might find that your son or daughter is playing football or netball and they're coming off either at the end of the game and limping, or later that night complaining of pain in their heels. And it's at the back of the heel, right on the bone there, and sometimes up into the Achilles as well. They can feel some pain. It's often associated as well with maybe arch pain in their foot as well. So the good news is that it's not a permanent problem. It's not something that doesn't go away. It can be treated. It takes until the growth plate closes. It can flare up and down over that kind of 2-year period. But if it's treated properly, then your child doesn't have to suffer. So we're just going to run through a few things now on what we recommend you can try at home, and then we'll go through the things that if you've tried all these things at home and it hasn't worked, then what you can do after that. So I'll pass over to Lydia, and she's going to talk a little bit about children's footwear, and probably particularly school shoes and like joggers.
Yes. Okay, so in terms of basic treatments, we'll start talking about some basic top 3 tips you can do at home. The first thing, if you experience the heel pain that you suspect may be Sever's, it's good just to modify your activity. When I say modify, you want to reduce your activities by reducing any high impact, whether it's jumping, running. You want to reduce that while it's symptomatic, but we don't want you to stop. Just a matter of trying to give that area time to settle down so the inflammation doesn't become chronic. So in this case, reduce your activities. Icing is a really effective way, and making sure that you wear shoes at home is a good way of reducing any stress to that specific region. The second thing you can do is wearing the right footwear. Now, footwear is a primary source of a lot of good treatments that you can use to help alleviate any condition, but in Sever's particular, wearing the right shoes can make a huge difference. So the kind of shoes you're wanting to look for is, to start with, something with a heel elevation. So heel elevation, you're looking for about 8 mil plus, ideally to that 10 to 12 mil. A lot of the good supporter shoes, if you go to Athlete's Foot, will have this heel pitch. So make sure when you're looking for shoes, you look for that heel pitch. Don't forget the basics in terms of having good arch support, having a firm midsole so it doesn't twist too much, and also having that adjustability and a firm heel counter. That's all still very important to pursue. And the last thing you can also try is some basic exercises. With Sever's, a lot of it's associated with growth and tightness, so we really need to address the tightness by making sure you do those regular stretches. The kind of stretches we normally recommend, and I'll demonstrate it to you right now, are wall stretches. So I'll take you forward with me to the wall. So excellent. Now you have your 2 hands on the wall, so your 2 hands should be around your shoulder length. Your front leg is your supporting leg, so that front leg is there just to really support the rest of your frame, but make sure that leg is bent, and it's your back leg that you're going to stretch. Now, when you have that back leg behind you, make sure both of your feet is faced towards the wall. So this is what I call a lunge position. Now, when you're in this lunge position, we're going to stretch specifically that gastrocnemius, which is that calf muscle there. It actually also does a good job in somewhat stretching that hamstring. So this is a really good stretch to give you that overall lower leg strength stretch. So as you push forward, make sure that that back heel stays on the ground, and as you push forward, you should feel that really good stretch. So you want to hold that for 30 seconds, and then you want to alter to a different stretch, is where you bend your back leg as well, and this time that stretch flows down to where the Achilles tendon and the soleus muscle is. So by bending it, you're stretching a different set of muscles, and you want to hold that for 30 seconds. So you want to alternate between the two, 30 seconds hold with the bend, 30 seconds hold with the stretch, with the leg straight, and you want to do that a good, I would say about 5 reps of each side. Just make sure you do hold that for a good 30 seconds. Now,
so, coming back to me, my turn. If you've tried all these things at home with your child and it hasn't worked, then you will need to go and see a foot expert, aka a podiatrist. So podiatrists study for 4 years at university, and basically we do feet, lower limbs, but predominantly feet and foot problems. So you want to go and see someone who treats this condition day in and day out. So at the podiatry appointment, they will watch your child walking, and they'll see whether there's actually a biomechanical underlying problem. And if there is, then we need to address that problem, because the growth plate isn't going to close anytime soon. So what we do is watch them walking, we look at their muscles, their joints, their range of motion, to see whether there's something that we can address biomechanically. And then if there is, sometimes we use like a heel raise in the shoe, and this just unloads where the Achilles attaches into the bone, and we do this short term. We don't generally, it's not a long term thing, it's just a short term fix until the growth plate closes. Now, if there is another biomechanical issue that requires orthotics, then we also do an orthotic. And often here at Brindabella Podiatry, we don't use very often custom-made orthotics for children, because their feet grow so quickly, and you don't want to be forking out all that money every 12 months unless you have to. So we use a kind of heat moldable off-the-shelf device that we modify for your child and their condition. And sometimes we use the orthotic on their own, sometimes we use the heel raise on their own, and sometimes we use the both together. And basically, if your child does all of these things, they're going to be able to play sport without pain, and the growth plate is going to close a lot quicker. So is there anything else you want to add?
If you wonder why your child might not be performing as well, there may be a reason. So do come and see us, because that's something where we can also influence the performance.
That's true. Sometimes children don't really tell you what's going on, or they can't explain it very well. And we have the sorts of questions that we know to ask, which will sort of find exactly what's going on. Well, we hope that's been useful to everyone out there. If you do have any specific questions about your child, then make sure you comment below here, and we can get back to you, or you can give us a buzz on the phone. We're more than happy for one of the podiatrists. There's 5 of us here, so you'll get onto one of us at some stage, and we can fill you in a bit more. Thanks! Have a fabulous... What day is it?
It is a Wednesday. Hope you enjoy the rest of the week before it becomes the weekend.
Bye!
Bye!